The following portion of Good Day PA is sponsored by WellSpan Health. We are hearing a lot about artificial intelligence and its role across many platforms. How about healthcare? WellSpan is the first in our region to use Breast Care AI. Excuse me. Dr. John Nawa is going to tell us about it. This is amazing to me. I said to you before, this is really fascinating. You're using AI in many ways for patient care. What specifically is Breast Care AI and what does it do? How does it help?
Yeah. Well, it's very cutting edge. It is FDA approved. Breast Care Artificial Intelligence, or AI, is a software program that is overlaid on top of a mammogram and is trained by millions of mammogram images to recognize patterns, characteristics that are typical for a breast cancer. So within minutes, it can generate a report and highlight areas on the mammogram image for the radiologist that basically says, hey, look here, this is an area that may be of interest to you, may be of concern.
Now, is this in addition to or instead of like traditional imaging?
So are you asking whether it would like replace
yeah, like do you still need the radiologist?
So it complements the expertise of the radiologist. So that circled area on the image is has to be validated by the radiologist as truly an area of concern that needs to be worked up or dismissed. And more often than not, it's dismissed, and might be dismissed because it is an area that's been stable for years, or it's an obvious area of scarring, or the artificial intelligence is being faked out because of something that's definitely benign, like some calcium deposits that are in the skin, not an uncommon finding. So it basically is like a second pair of eyes. It essentially taps the radiologist on the shoulder and says, hey, look here, this might be an area that is concerning, and definitely a product that has the potential to improve early detection of breast cancer.
Which is, of course, you hear so much about early detection is key. Also, a lot of discussion in recent years about dense breast tissue and sort of sometimes mammography, just struggling a little bit there with that. Will this help with that?
Yes, the short answer is yes. It definitely improves the detection of breast cancer in that dense breast tissue patient population. Couple of points, 3 points I like to make when I talk to patients about breast density. One is dense breast tissue is white on a mammogram. Breast cancer is white on a mammogram. White next to or within white is very difficult, cumbersome, troublesome for the radiologist to detect. Second point, breast density is an independent risk factor for breast cancer. So the greater your breast density, the higher your risk for developing a breast cancer. Third point, 40 to 50% of women have dense breast tissue. So if you take those 3 points, you can see why radiologists are excited about any tool that can help them detect breast cancer. You can see why someone like myself and my colleagues are so excited about working at an institution like WellSpan that gives me the tools to optimally care for patients in an accurate and timely manner.
I think it's terrific. It's one of the best things I've heard about breast cancer in recent years. It's really interesting. Thank you for being with us. Really good to have you with us. The previous portion of Good Day PA was brought to you by WellSpan Health.